It's my absolute pleasure to welcome all of you to our first Dean Seminar Series of the year. We are thrilled to have Dr. James Rimmer join us today at the start of this year's series. Dr. Rimmer is currently professor in the School of Health Professions at the University of Alabama at Birmingham. Dr. Rimmer's principles of interdisciplinary collaboration and disability and inclusion resonate throughout our college, and this is why we are honored to host him for our Dean Seminar Series. Please join me in welcoming Dr. James Rimmer.
Thank you. I think that you've got an opportunity, having all the pieces from social work to therapeutic rec and all of the rehabilitation components in your college, to be able to look at a continuum and get somebody who really understands this and takes that concept of health and rehabilitation sciences and begins to build a new continuum of care that goes from the hospital to the clinic to the community and to the home. So we've got to build what I call an inclusion science, which ensures, and maybe even have a federal law that says no study that is funded by the federal government has the right to exclude people with disabilities. But you know what? When you get into the literature, the first thing you see is the #1 exclusion criteria, pre-existing condition. So if you're doing cancer research, if you're doing diabetes research, if you're doing heart disease research, it has no generalizability to people with disabilities because they were excluded. So how discriminatory are we? We've got a great Americans with Disabilities Act, but does it apply to research? No. So we are unintentionally, for the most part, discriminated against 50+ million Americans who have pre-existing conditions, and any evidence that comes out is not applicable to them. You know, it's as plain and simple as that. And yet, it's a very simple solution. I have nothing that I can give you. I have things I can share with you, but it's really you who will be the agent of change in your community and in your profession. I will be your wing person. I will be there to help support you, but you sit on the pot of gold to make a change in each of the communities you're working in. So I hope you leave with the understanding this is not about Jim Rimmer. It's not about some big-time national center. It's about you finding the tools that you need to do a better job to serve the community of people who have been underserved and largely marginalized in our society. And so with that, I'm going to say thank you very much for inviting me, Dr. Sawar, the colleagues that I went to dinner with last night. Thank you for coming to dinner, and thank you for being here today. Have a good weekend.